So I want to talk a little bit about some of the learnings that we've had at launching a mass vaccination center at Gillette Stadium. So as Ramesh said, I'm an advisor to PathCheck Foundation, but also work very closely with a firm called CIC Health, which has launched the first mass vaccination center here in Massachusetts at Gillette Stadium, where the Patriots play. You might have read some press about it over the last few weeks. You know, the interesting thing, just as a way of background, is that we launched this in less than 4 weeks. So from the moment that the call was made to the Department of Health to want to do such a thing, to actually injecting the first vaccine to somebody was actually less than 4 weeks, which is a pretty amazing feat of contracting and logistics and a whole lot of other things to pull this off. And there's multiple parties that came together to make it happen. So it has been a pretty significant effort. And at this point, we're doing thousands of vaccinations a day. So the Gillette Stadium environment, as you can imagine, is expansive and gives us an opportunity to grow very quickly. And there's a lot of discussion around how to do that. And we are now into our second and a half week of this, and we are doing multiple thousands of people a day, and it's and there's a lot of learnings. You know, one of the things that I think from the last 4 weeks has certainly been that it's one of those things where everybody has a plan, but once you get into battle, you have to throw the plan out the window and reinvent it pretty quickly, and that certainly has happened a few times as we've learned a lot about how to launch these centers. So I think there's a lot to be said about practical on the ground knowledge that comes from this, and lining up against some of the theory and work that's done beforehand. So here's a couple of pictures of what the center looks like. It's actually grown quite a bit from the last time this picture was posted. But as you can see here, there are multiple vaccination centers. There's a lot of signage. There are observation lounges. You know, we're privileged at the Gillette facility to have these massive screens. In fact, I think there's 25 plus televisions that are in eye shot of everybody who's getting vaccinated or getting observed. And that gives us a lot of opportunity to demonstrate, you know, to push out messaging and remind people to do certain things that we'd like them to do. So that's one important sort of lesson, is to think about the captive audience that you have at the time of vaccination and the messaging that you want to give them. So we have a lot of privilege to do that there. You can have an idea here of what it looks like on the ground and all those different screens and how all the vaccination centers are lined up for people to get vaccinated. I want to talk about some of the major learnings, just very briefly, about what we've learned from this experience. The first one is when you think about, if you think about the stack of vaccination experiences that everybody will go through, I think they fit into 3 significant buckets. At the top of it is you have these super pods like Gillette Stadium, or what's going on in Disneyland and other public, large public sites around the country. Then you have the middle, which is your pharmacies, your primary healthcare facilities, your community clinics. And then you have the bottom, which is mobile clinics going into neighborhoods and reaching as many people as you can, especially those that are in vulnerable population centers that don't have the wherewithal, don't even have a primary care doctor, so they don't even have a clinic to go to, and don't have the wherewithal to take time off work to go to a super pod. I think it's at the top and the bottom of that stack is where the majority of the innovation needs to happen, especially around the digital experience. There's quite a bit of infrastructure in the middle. It's the top and the bottom is where we're doing things that we've never done before. There's never been these sort of super pod types of environments. We've never sent mobile clinics at the number that we need to into neighborhoods to vaccinate people ever in the past, at least in modern times. And so if you look at the infrastructure that exists within healthcare today, that's where the innovation is going to happen. So one thing to think about if you're working in this area is where you can really make a difference in those 2 areas. So that was sort of learning number 1. Learning number 2 is to really think about this as an experience. I think we take for granted the fact that people who desire to get vaccinated, so there is absolutely a public health campaign that has to happen to make sure people understand that this is the right thing to do and it's the safe thing to do. But even if you convince them of that and they are motivated to get vaccinated, it doesn't mean that they'll go through all the necessary hoops we put in front of them to get vaccinated. And if we think of it like a sales funnel, if I have a desire to buy something off of an online shopping website, I actually have to go through an experience that allows me to do that very quickly, or I'll go somewhere else, or I won't do it. And so if we think about the process by which we ask people to schedule appointments or to fill in personal health information or to fill in their own data about themselves in order to get an appointment and then show up, and knowing that they have to show up at a particular date and time and place, all of those are opportunities to lose people through the funnel. And just because they have the motivation to go through the funnel to get vaccinated doesn't mean they'll do that. And we have to continually architect this as if we're designing a sales funnel online, where we want to remove points of friction at every step of the process, both digitally and physically. There will be many people who will attempt to get vaccinated or want to get vaccinated, will miss appointments and just never get back to it. And I sort of think of the last 50 or last 100 million people that get vaccinated in this country will be a long tail of people that we have to try to reach. And one of the factors to make sure we do that as quickly as possible is to make that funnel as efficient as possible. So that's lesson number 2. Lesson number 3 is scheduling is really, really non-trivial. This is a big problem that is happening everywhere in the country. As we talked about earlier, that when appointments become available, they get booked up very quickly. The notion that I have to schedule something and then show up at that particular date and time is not conducive to a large amount of people in this country who work hourly wages, who can't afford to take time off work, who can't afford to get onto public transportation to go somewhere and get vaccinated. They can't afford to make a schedule about anything because they will take whatever work they can to from a career point of view. So making sure that we make scheduling very simple, and in fact, in some cases, remove scheduling altogether, as was proposed earlier, is going to be, I think, a really important learning. Also, second doses, that's a really non-trivial issue. Making sure that people have the second dose schedule available for them. At Gillette, we have a 95% success rate in getting people to schedule their second dose before they leave the site. Which I think is really strong, and we're gonna have to work really hard to keep those numbers high. Fourth one is keep it simple. A lot of us are technologists. We like to throw technology at the problem. Less technology is actually better, because when there's more technology, there's more opportunities for errors. There's more opportunities for breaks in the workflow where friction will exist. And it's better to keep things really simple and remove as much technology. So the idea of these paper cards, I think, matters a lot. The last thing is customer service really matters. If you think about it this way, for millions of Americans, this will be the first time that they go through some formal healthcare experience. We want to make sure that this is important, that we take the time to care for people, to deliver it safely, but with kindness and a smile. That's the only way we're going to get people, when they come through the experience, to tell their friends and family to also get vaccinated. It can't be highly clinical. That's one thing that we think a lot about at CIC Health, is how do we make this an experience that's really awesome? We're opening Fenway Park next week, so you can come get vaccinated at the famous baseball stadium. Also a lot about making sure that experience is a really nice experience. For many people, it's the beginning of the end of COVID for them, and I think that's a really important thing to acknowledge. So I'll pause right there, but I think those are some of the big learnings that we've had about setting up the first mass vaccination center here in Massachusetts.
That's thank you for sharing that, Vinay, especially your last point about the user experience in this case is probably going to decide how, socially it's acceptable to go through this vaccination. It's because it's not just about the jab in the arm, but everything that happens before that and after that. Can you just share? I would like to invite Chris and Asif back on the panel, if you can turn on your videos, so we can have a open, frank conversation here. So Vinay, just to start with you, are there things that you have seen that are, like you said, we want to remove technology from this whole workflow? I love how Chris is thinking about an SMS-based system, or the work with MIT and IDEO and PathCheck of just analog vaccination cards. Are you seeing such innovations that could essentially remove technology as a barrier, as opposed to this this obsession that we have, that we think that when we insert technology, things will always get better?
Yeah, I think the SMS-based approaches are really important. If we think about it, right now in Massachusetts, we just announced that we're going to 75 plus starting next week. So if you're 75 years or older, you are eligible to get vaccinated. They don't have smartphones. They're at that cusp where they might have not ever adopted a smartphone. They might still have home phones. So how do we facilitate those people to be able to make appointments where they have a simple piece of technology, or that somebody else is going to be making that appointment for them, such as their adult children, and making it really easy for somebody to represent somebody else. Like that's an often forgotten use case, is that the vast majority of people who really need a vaccine will be having their schedule made by somebody or having their appointment made by somebody else. And so just thinking through those digital experiences where that's actually a supported process where people don't have to hack around that, I think is going to be an important thing. But then as I talked about, just simple SMS links that you can pop open on your phone to do something really quickly and pop out of, I think those are going to be really, really useful. If you think about the idea of a mobile clinic showing up on a street corner and telling people around them, hey, if you're walking to the train, if you got an extra 5 minutes, let's get you vaccinated. They don't have 10 minutes to fill out something on their phone. That will take up all the time they have. And that's how long it takes now. So you've got to think through those use cases very differently.
Good. Chris, Asif, any thoughts on effectively how to make it as easy as possible for users, and the difference between stadiums versus pop-ups versus formal pharmacy or hospitals? Those three seem like very different experiences.
Well, they do.
Go ahead, Asif.
Well, they do, and your opportunities in each are unique. I love how Vinay talked about Fenway, and that's an opportunity. That's an opportunity in terms of experience. For others that want to go to where they're at physically, there's a comfort in being vaccinated or in a community, and having those community centers being supported, nurtured, blogged about, tweeted about, whatever social platform that people have locally, in order to make it so that it's a community activity. Don't forget that we are influenced by the people that we happen to be influenced by. And so that's crucial in terms of the design experience. And so each of those venues has a unique opportunity. Also, the physical organization of how you set them up is radically different. If you have to drive somewhere, you got to really think about parking. That's not insignificant. If it's public transportation you're talking about, that has to be really thought through very clearly. And finally, if it's walkable, you have to make sure that walking experience is also reasonable. Time, distance, how the lines are set up. And finally, it's cold in part of America right now. And you have to appreciate that if we've got people sitting in the cold for 3 or 4 hours at a time, they may leave. They may leave.
Totally agree. Wait, one thing to think about is how to push some of these experiences to the edges. So leave people in their cars before they wait in line. Tell them when to leave their home, estimating their time for transportation before they show up too early. Like these are all things that where if you don't have a lot of people congregating in one place and getting cold and waiting in line, but rather push them out so they can do those in the comfort of their home or car, like that, the logistical movement of people is super important.
Yeah, I couldn't agree more. As you get to the edges, the end becomes more important. The choice becomes more important. Right? We can't assume that everyone's going to do things the same way. And to your point, Vinay, the long tail of the last 50 or 100 million people is going to be hard to get to, because you can't predict what situation they will be in. They might go to Fenway Park, to get their first shot, but a month later they may go to a pharmacy to get the second shot. So the option to go from an electronic to a paper process, or from a paper process to an electronic process and back and forth, is really important. We also found that, early when the pandemic hit, we had to actually design from scratch a new solution, which we called virtual front desk. And it's kind of interesting how that happened, because physicians started to tell us that patients didn't want to come in, not because they were afraid of getting infected in the office, but they didn't want to sit in that front office for 30 minutes, which was a typical waiting time before the physician actually saw them. So we had to create a solution where you could enter all your registration information remotely, and then do exactly as you said, sit in the parking lot in your car on the day of the appointment. And you would text the physician that I've arrived and I'm sitting in my car. And when the physician was ready to see you, they would text you back and then you would walk in, right? I mean, that kind of system, you would not even have thought as being relevant, maybe a year ago. But now people will take that for granted. People will not want to stand in line 6 feet apart out in the cold, especially if the line is going to wrap around the pharmacy twice, right? So I feel that the more flexibility we can provide people and the more workflow enablement we can do, and that this is critical because people, especially pharmacists who are busy, physicians are busy, they don't want to have to fill out yet another piece of paper, look into yet another screen. We have to make the technology invisible and make it disappear. And that requires many of the existing players, frankly, to work together. So it's an incredible opportunity for across the industry collaboration, because no single entity, no company, no government agency can do this all by themselves. We have to show that we can all play as a team.
That's fascinating. Switching topic a little bit to vaccine credentials. I know there is kind of a mixed feelings about it, will it lead? Will there be a scenario like some people say that, hey, if you're going to other than airlines, which is kind of an extreme case, in most scenarios, either you have people who are all safe, or there are people who are just have to wear masks and keep social distance, and anything in between, where some people are vaccinated and they have special rules, may or may not work out. I just want to hear from all of you about how you're seeing that. Is vaccine credentials going to be a thing, or is it going to be used in very niche areas like airlines and so on?
Well, I'll start off with some high-level comments. We have vaccine credentials in the U.S., but they're on paper, broadly speaking. The question is how they're used, and are they digitized, and are they shared, and are places of work, business, entertainment, sports, and travel going to be limited by the behaviors you do or your willingness to undergo a treatment? And that's a more complicated social question that we as a society have to get into. I want to make one comment about the last topic that I'll lean into this. It isn't that technology isn't deployed, even in the IDEO example, Ramesh, that you guys went through. Technology obviously is deployed, otherwise how are you going to use a QR code, right? The question is how do you manage the user experience so it's as simple and easy, comfortable as possible? And people have some sense of confidence and agency in the experience. And I think that's what we're solving for as a society right now. I think right now, the most important thing we do is to get as many people vaccinated as possible. So number one, people look around and they're like, well, I didn't see that many people having issues and they're healthy. And there's positive reinforcement in vaccination. Things become popular because your friends and colleagues do and they have a decent experience. But if your friends and colleagues have miserable experiences and people don't want to do it. So I think that's the thing we're laser focused on. I think a lot of the discussions about the use of information go back into the conversations we've been having forever. Where's your data kept? How is it kept? How is it used? How are certain behaviors going to be rewarded or incentivized therein? It's a social question as much more than it is a technology one.
I would agree. I think having the social comfort with the vaccination process and building a little bit of social peer pressure as well that comes from a positive peer pressure. If you see a lot of people around you vaccinated, you want to be looking forward to getting vaccinated yourself. And if you hear a lot of people being concerned about the process or even being turned off by the inconvenience of the process, others will start to say, you know what, maybe I'll put off my vaccine for a couple of months until it gets easier, right? You don't want that happening. So the initial experience is really important because it'll set the trend, positive or negative, for people. And then as you go through this, your question, Ramesh, was about, the impression people get, the safety or lack thereof they feel from the vaccine. I think the credential in particular is more for the person's own use, right? Over a long term, right? Think of this as a journey from the time of vaccination over the next 6 months, 12 months. It's likely that you'll need a booster shot 9 months from now if the variant, new variant that is significantly mutated, right, is prevailing around that time. You never know. So having a system that is tied to the patient and is free of other inconveniences is important. And for the patient to be able to quickly recall that information and interact with it without the typical barriers that we've erected for the rest of healthcare data. We all know those. Healthcare data today is not easy to interact with. It's all pretty, boxed in and tied down. This is one of those pieces of information that needs to be liberated and actually should be tied to the patient from the get-go.
Fascinating. We're reaching at the top of the hour, so I'm just going to remind everybody about our presentation today. I want to thank Chris, Asif, and Vinay, and I encourage you to stay on for our private session. But for the public session, we want to thank you, and also for vaccine credentials. I wanted to kind of put this diagram from one of our upcoming papers, which is when we think about whether it's the coupons, which you can think of them as gift cards, or think about badges, which are more like health passports, or abilities to upload your health information for reporting to CDC or vSafe. You can think of this kind of offline versus online models. You know, the holder, the user can be offline, can have intermittent online access, or can be online at the time of interaction, or the verifier, which could be a coupon verifier, the vaccination site, and so on, can be offline, intermittent online, or online. And the analog cards that MIT and PathCheck and IDEO showed in the first half of the presentation today is kind of at the bottom left. It's like offline, offline. Everybody can be offline. The user just has a paper cred, and the verifier doesn't have to be online. They can verify it with an app that doesn't need to be connected to the internet at that moment, and they can still validate it on the go. And then the bigger bubble is the offline app creds, which is still using this offline credentials that Anna talked about, and can have intermittent access and go forward. And then, and some of this, as Chris talked about, is you could get an SMS, and at some later point, you might open that link, for example. And then the more traditional credentials that you may have seen for online credential verifications require the user to be online and the verifier also to be online. So they need live access to the internet. So this whole space is actually pretty exciting, and depending on the scenario and depending on kind of the sophistication of the user, you might choose one or the other. And each of them, of course, have their own positives and negatives in terms of trade-off between ease of use versus likeliness of fraud and so on. So I just want to kind of put it out there so we realize that there's a pretty wide design space as we move forward. So I want to thank everyone for joining today. And we talked about paper cards and SMS and apps. Then we heard from our partners at Adobe, MIT, and Mayo Clinic of the Deep ABM, a new way to merge agent-based simulation with graph neural networks for predicting COVID-19 scenarios. We heard from Chris Soshi from Change Healthcare, Asif Dhar from Deloitte, and Vinay Gidwani from CIC Health on expertise in vaccine administration. So please check our website, pandemic.mit.edu, and also join our Slack at tiny.cc/PathCheck Slack. Thank you, and we'll see you next Tuesday for the MIT conference on vaccines for all.